We'll be going straight into the next two sessions, which are brief interviews with three countries, in effect, the ministers of Uruguay, the health advisor in Mongolia, and then, of course, the health minister from Kazakhstan. We're going to start with the two, Uruguay and Mongolia first. And could I invite, please, the Minister of Health from Uruguay and also the assistant to the Minister of Public Health in Mongolia. Could I invite you up to the stage? Thank you. Thank you, Minister. Hi. Just have a seat here. It's okay. Can I ask you to sit here? Thank you. So, the purpose of these sessions really is to find out really a little bit more about what different countries are doing in relation to universal healthcare, and also to hear their perspectives on how cancer control is being integrated into universal healthcare, and the challenges and indeed, I suppose, the progress that has been made in and around those things. So let me begin by introducing Dr. Jorge Basso. Dr. Jorge is a physician, and he's also the Minister of Health of Uruguay. And of course, we heard yesterday, unfortunately I missed it, but we heard yesterday that the President of Uruguay received a commendation, an award for the outstanding contribution to cancer control. So lots of good things happening in Uruguay. Can you just can I step back a little bit and just ask you, first of all, what are the healthcare reforms that were undertaken in Uruguay and put in place to achieve universal health coverage?
Buenos días, un gusto estar en este panel. Permítanme comentarles de que en Uruguay, desde el año 2005, se viene desarrollando una reforma sanitaria. Es una reforma estructural que tiene como base la creación de un fondo público, Fondo Nacional de Salud, su fondo único, al cual aportan todos los habitantes del país un porcentaje de sus ingresos, que va entre un 4 y un 8% según el núcleo familiar, siguiendo el modelo Bismarck a través de la seguridad social. Y este fondo único aporta a los distintos prestadores públicos y privados una cápita ajustada a sexo y edad para financiar un paquete de prestaciones integral, muy amplio, muy abarcativo, que cubre todas las necesidades asistenciales de la población. Este fondo público, además, paga a las instituciones por resultados, un pago por performance, en función de logros concretos vinculados a las enfermedades no transmisibles. Es decir, que funciona este fondo como un financiador de todo el sistema de salud, tanto público como privado, de manera tal que la población paga según sus posibilidades y recibe las prestaciones según sus necesidades. Y estimula a través de objetivos sanitarios que los prestadores logren con todos sus usuarios y no solo con sus pacientes mejores resultados en materia de atención integral, entendida esta como prevención, promoción, asistencia y rehabilitación. El paquete de prestaciones es muy amplia, cubre todas las necesidades de la población, inclusive aquellos procedimientos de alto precio y los medicamentos de alto precio. Como ven, no hablo de medicamentos de alto costo, porque hay una diferencia entre el precio y el costo. Preferimos hablar de alto precio de manera tal de que podamos mantener lo más actualizada posible esa canasta con negociaciones con las distintas empresas, con las distintas industrias, muchas de esas negociaciones a través del Mercosur, que nuclea a varios países del continente americano. Los objetivos sanitarios se monitorizan a través de un sistema de registro. En este momento el Uruguay tiene una historia clínica electrónica nacional para el 100% de los habitantes del país, que permite auditar calidad, que permite mejorar el control de los costos y de alguna forma hacer el seguimiento de los alcances, de las metas y de los logros en materia de indicadores sanitarios. Particularmente nos interesa mucho vinculados a los indicadores del cáncer, en donde el Uruguay ha mejorado sistemáticamente la mortalidad por cáncer, sabiendo que la incidencia del cáncer en todos los países, particularmente los de índice de desarrollo humano elevado, tiende a aumentar. En la medida que aumenta la expectativa de vida, de alguna manera también previene y mejora y disminuye la mortalidad por otros tipos de enfermedades, pero la disminución de la mortalidad por cáncer ha sido muy importante, incorporando screening de prevención a través de mamografías, a través de búsqueda de sangre oculta en materias fecales, a través de exámenes de colpocitologías oncológicas y a través de un chequeo continuo a toda la población. Ese financiamiento es aproximadamente el 6.5% del PBI del sector público y alcanza en la totalidad el 9.5% del gasto en salud en el Uruguay.
Thank you. We are having an interesting translation challenge going on, I think. Let me just, Minister, let me just ask you a couple of things, and then I'm going to move on to Mongolia. Prevention has been a really important part of this morning's discussion. And I know that Uruguay has put in particularly strong interventions around tobacco control. Can you tell us a little bit about why you've decided that tobacco control is really so important? I know Princess Dina Mered mentioned it earlier, and I think it's really quite fundamental. Why did Uruguay decide to be so clear about its intervention around tobacco control? And what are you expecting to achieve in terms of outcomes from that?
Bueno, la evidencia científica con la cual contamos demuestra que el 30 al 50% de los cánceres se pueden prevenir trabajando sobre un conjunto de factores de riesgo y a su vez hay un porcentaje significativo de cánceres cuyo diagnóstico precoz permite la curación o al menos prolongar la calidad de vida y la expectativa de vida de los pacientes con cáncer. Estas políticas no se resuelven solo del sector salud y por lo tanto el presidente de la República ha promovido una serie de marcos regulatorios vinculados justamente a trabajar sobre los factores de riesgo. No me voy a extender sobre las políticas vinculadas al tabaquismo, por todos conocidas, pero últimamente he incorporado una serie de políticas vinculadas a la promoción de la alimentación saludable, estimulando fuertemente la lactancia materna, trabajando fuertemente en el etiquetado frontal de alimentos envasados que tengan exceso de nutrientes críticos, de tal manera que el consumidor pueda rápidamente identificar la no conveniencia de consumir en exceso esos medicamentos. Se ha promovido fuertemente también la actividad física a través de gimnasios en los espacios públicos y una campaña fuerte de comunicación para que las personas se hagan exámenes periódicos, se hagan controles, se hagan screening y puedan rápidamente diagnosticarse patologías, tratando de cambiar aspectos culturales muy arraigados en la población, de temores, miedos a controles de este tipo.
Just to wrap up, I mean, one of the things that, one of the abiding challenges, I think, of all universal healthcare systems, particularly ones in high-income countries like yours, is how do you create equitable outcomes and equity of access, despite the fact that you have a good universal healthcare coverage? What is it that you're doing to try and create greater equity of outcomes, particularly in cancer? I think it would be interesting for us to understand how you're addressing that. And do you understand that there are, I mean, how do you measure the equity of outcomes in Uruguay?
Sin lugar a dudas, el sector salud es el paradigma de la complejidad. Ninguna de estas medidas son sencillas. Lo primero es lo primero, y eso tiene que ver con decisiones de carácter político. Se requiere mucha voluntad política para trabajar en estos temas, porque se rozan muchos intereses, y eso implica, bueno, trabajar también logrando los mayores consensos políticos en el país, porque ninguna de estas medidas son a corto plazo, requieren políticas de Estado, requieren tiempo, y eso, bueno, significa justamente lograr acuerdos con todos los sectores políticos para promover normas, leyes que disminuyan los marcos de incertidumbre sobre el futuro. A partir de ahí, bueno, tomar decisiones basadas justamente en la evidencia científica, con la mayor participación posible de la academia, involucrar fuertemente a la sociedad, a los sectores sociales, a la participación de usuarios, a la participación de funcionarios, involucrando fuertemente a la sociedad. Ninguna de estas campañas se logra exclusivamente con medidas coercitivas, con medidas impositivas. Todas son importantes, tienen que manejarse globalmente, y por eso los mayores esfuerzos están vinculados obviamente a seguir dándole sustentabilidad a estas medidas, seguir involucrando fuertemente a la población, comprometer a todos los sectores políticos en esta tarea. Como ven, todas cosas complejas, para nada sencillas, pero en el Uruguay, bueno, esta reforma ha sido tan exitosa que en plena campaña electoral en este momento, estamos próximos a las elecciones, nadie discute la bondad del sector salud.
Minister, thank you very much indeed. And let's turn now to a perspective from Mongolia. And I'm delighted to welcome Batmunkh, who is the advisor to the minister at the Ministry of Health in Mongolia, and also founder and CEO of the National Cancer Council of Mongolia. Tsegi, you know, Mongolia is not a country I know a great deal about, and I'm sure it's going to be an edification for everybody in this room just to hear a little bit about Mongolia. And I can only imagine that one of the serious challenges that you face in Mongolia is the enormous scale, geographic scale of the country, and the provision of both universal healthcare and cancer services across this country. Tell us a little bit about some of these challenges that you face and how universal healthcare has been rolled out.
Thank you so much. So Mongolia is a landlocked country located at the center of Asia between Russian Federation and China. And with the total territory 1.5 million square kilometers and with relatively small number of population, only 3.5 million, there is a huge disparity to reach out the whole population. And it is one of the most sparsely populated country in the world. And majority of the people, around 50% of the population live in capital city, but remaining 50% it's spread out through the country. And provision of quality healthcare and reaching out without leaving no one behind is relatively challenging issue for healthcare professionals. And also, in addition to this, we have really extreme weather conditions. So we have really hot summer from plus 30 to minus 30, 40 degrees during the winter time. And this kind of geographical and climate issues are really challenging for the health professionals. So you can imagine, for example, if you have emergency call during really winter time, midwinter, and the doctor has to travel many miles away to reach the family. And in some places, only car cannot be reached. And the doctors has to ride a horse, camel, or even reindeer to reach that remote.
Reindeer?
Yes.
I didn't know you could ride a reindeer.
We do have reindeers.
Fantastic. Yeah.
So, and healthcare professionals need to have certain skills besides medical skills. For example, how to ride a horse.
Right.
So, for example, from my personal perspective, I started my work career as a GP doctor in one of the really remote southern parts of Mongolia, bordering with China. And I had to take my patient to the nearest provincial hospital around 300 kilometers by really old style car without any air conditioning in plus 40 degrees during summertime. So it took me, for example, more than 12 hours to reach the nearest hospital. And in some cases, I even ride a horse or ride a motorbike to reach the family. So these are really the hardships healthcare professionals face to reach out the families living in remote places in our country.
So tell us, in that context, tell us a little bit about how, because Mongolia did at one point have universal health coverage prior to the sort of marketization of the economy. And then it sort of slipped, but now it's come back. What is the focus? What is the, I suppose, how are you beginning to put that together, and how is cancer integrated into the universal health care program that you have?
So Mongolia is doing relatively good in comparing to countries in Western Pacific region to have quality, accessible health services, essential health services. So cancer care is covered by the universal health coverage. So whole continuum of cancer care, starting from the screening, diagnostic, treatment, and palliative care is covered by the government. So in terms of screening programs, we started screening cervical and breast cancer screening in 2012 and liver cancer screening in 2016 because of high burden of liver cancer. So screening program is in place and it's covered in all GP hospitals. It's available, so everyone can access this free of charge for the screening program. And in terms of treatment program, the majority of treatment will be done in capital city, and all patients have to travel to the capital for the treatment. But some services, some chemotherapy will be available in provincial level. And it is also covered by the government. And palliative care is also covered by government, and everyone can access palliative care.
So in a complex system like that, where you have to bring people from the provinces and from distant localities to the capital for treatment, there are no facilities outside the capital, is that right?
Only chemotherapy will be available in countries, in provinces.
Chemotherapy would be available, yeah.
But majority of other specialized treatment will be only
surgery,
available.
Radiotherapy.
Surgery, radiotherapy will be available only in the capital city, which is really another burden for the families who have to travel to long distances from home to the capital city.
So in terms of the funding of universal healthcare and cancer coverage particularly, how does that work for those families and those individuals that have to presumably stop working in a distant place in Mongolia, come for treatment, and their families probably come to some degree with them? How do they fund that? And are out-of-pocket payments still a serious problem in Mongolia?
Usually the treatment will be covered by the government, but additional costs like transportation, accommodation, or social things, living without any salary, wouldn't be covered completely. And that is why this is the burden for the families. But in terms of healthcare financing, we spend 2.5% of our GDP on health finance, and majority of our funding will be going from the state budget, state revenue, and social health insurance, and a really small proportion would go to out-of-pocket expenses. So people, the percentage of out-of-pocket expenses is ranging from 2 to 6%, depending on the...
Yeah. And I mean, 2.5% of GDP, still relatively low. Are there plans to raise that amount as an overall amount of public spending for healthcare? Are there plans to raise it?
Yeah, the funding is always the really biggest challenge for the health sector. In some years, we have percentage of GDP health financing would increase to a certain percentage, for example, to 4 to 5%, but in some years it decreases. So it's really not constant, the percentage of health financing in our country.
And I mean, do you see potentially innovative models of financing as being a way to supplement the shortfall in funding, the gap in funding that you might see in funding healthcare in Mongolia, or is that not under discussion at the moment?
So we have Health Promotion Fund, which is consisting of 2% of tobacco taxes, 1%...
So sin tax effectively.
Yes, sin tax, yeah. 1% of medical medicines, and 2% of medicines, and 1% of alcohol products. So this Health Promotion Fund is usually spent on promotion of healthcare, awareness of healthcare awareness, and then reducing risk factors of non-communicable disease and especially cancer. So this is one type of funding which can be considered as an additional fund.
Can I just ask you briefly, and just to end off, I mean, there are, pity we couldn't have a bit of a longer conversation, but just your own role in the National Cancer Council of Mongolia as a founder and CEO of that. And I'm assuming is that an NGO that works to promote cancer and cancer control, particular kinds of patient awareness and so on and so forth? Is the government, obviously, as you're an advisor to the minister, the government obviously seems quite receptive to having civic organizations, civil society organizations inputting into policy. Is that something that you see as being important as a way of influencing and changing and accelerating, indeed, government actions around cancer and cancer control?
Yes, definitely. Having strong voices of civil societies is always really important thing. But Mongolia is one of the countries of post-socialist period of time, and we didn't have many social and civil organizations. And this culture is currently relatively new to our post-socialist countries. And the role of civil society is, of course, really important. And I think over the last 2 decades, the role and importance of these organizations are becoming more and more. to influence the government, to push the government for certain policies and changes.
Fascinating. An amazing country, and thank you so much, Sigi, for sharing that with us. And also, Minister, thank you very much for sharing Uruguay's experiences. Please join me in thanking them for their thoughts.